Hello, welcome to the Lone Star College North Harris Associate Degree Nursing Program Information Session. My name is Juanita Garcia. I am the advisor at Lone Star College North Harris. The Lone Star College North Harris Nursing Program is located at a Health Professions Building, and the Health Professions Building is off of Red Oak Drive and Peakwood Drive, and it is behind the Houston Northwest Medical Center. What is nursing? We took the most current definition of the 2010 edition of the American Nurses Association Social Policy Statement to define nursing. Nursing is a protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and population. Where do nurses work? Nurses work in hospitals, clinics, doctors' offices, schools, home care, long-term care facilities, occupational settings, community, military, and so many other areas.
Employment trends for RN. There continues to be a shortage of nurses in the USA. However, many urban hospitals are seeking magnet status that requires a majority of staff to hold or be making progress earning a BSN. There are still many jobs rurally or in other non-acute care settings, so students may need to consider relocation or seeking employment in agencies other than hospitals after graduation.
2 tracks are offered for the completion of the Associates of Applied Science and Nursing at Lone Star College North Harris. We offer the Articulation track, which is a transition track for current LVNs and certified licensed paramedics. This is a 3-semester clinical program, and it starts in June. The other track is a basic track. With this track, you don't have to have prior healthcare experience, and it is a 2-year clinical program beginning in August. The Lone Star system offers 2 curriculums in nursing. We offer the integrated and the block curriculum. The integrated curriculum is offered at North Harris, Kingwood, Montgomery, and Tomball. The block curriculum is offered at Cy-Fair. The integrated curriculum is a program organized around a series of concepts that progress from simple to complex, whereas the block curriculum, their program courses are divided by content areas such as children, families, and adult health. Lone Star College North Harris Nursing Program is a daytime program. Students are generally busy 3 to 4 days out of the week for the program. You will have lecture, which are 5 contact hours, lab, which are 2 contact hours, clinical, which can range from 10 to 12 contact hours, and a course test. Here is course content covered in the program. You have role of the nurse, perception psychiatric, heart, lungs, pregnancy, newborn, diabetes, nutrition, etc. The teaching methods used in the Lone Star College North Harris nursing program are the following. In lecture, instructors use PowerPoint, visual aids, D2L system, which is the Lone Star online system, and readings. In lab, students will have hands-on skills training, use of simulated mannequins, and videos. For clinical, students will have direct patient contact at area hospitals and long-term care facilities. They will also be doing clinical logs and care plans on their patients. There will also be projects. There will be individual and group projects, research papers, posters, presentations, etc. The exam schedule for the Lone Star College North Harris nursing program is the following. Lab tests are weekly before each lab begins. Lecture tests are before lecture. Dosage calculations / math tests are before lecture. Please note, you must pass the clinical, lab, and lecture components of the program with a 75% or higher in each section in order to progress to the next semester. Students will have to pass a math component with the 90% or higher in order to progress in each semester. And for the math exam, you will have 3 attempts to be successful in the exam. If not, you will be withdrawn from the program. Other program information. Please keep in mind that there is no formal math course taught during the program. It is important to refresh math if needed prior to application and program start. Anatomy and physiology and medical microbiology, please do well in these courses because the instructors do expect you to know this knowledge. Pharmacology, which is RNSG 1301, it is strongly advised that you complete this course before starting the nursing program. Getting started. Students must first have applied to Lone Star College, unless you're already a current Lone Star student. Submit official transcripts from all non-Lone Star College system schools attended. Meet with the LSC advisor as needed to ensure you have declared nursing as your intent/plan and to discuss nursing program requirements. You can find nursing program information on the Lone Star College system website and also through the Lone Star College North Harris Nursing Program website. Please see both if needed.
LSC North Harris application periods and deadlines. All nursing applicants will need to submit an application online. Go to the Lone Star College North Harris department webpage and click on the blue Apply button. Underneath the blue Apply button, you'll find instructions on how to apply. Make sure the following documents are in a PDF format: the signed FERPA, a credit advising transcript, and hepatitis B quantitative titer. Application deadlines can be found at www.lonestar.edu/13465.htm. Acceptance and denial letters will be sent via email to your My Lone Star email account. Basic track admissions criteria. Prior to application, the following courses must be completed with a GPA of 2.7 or higher and at least a C in every course. The courses are Biology 2401, Human Anatomy and Physiology 1, English 1301, which is Composition and Rhetoric 1. Courses must be completed and graded not in progress during the application period. Other required courses for the basic track are Biology 2402, Biology 2420, Psych 2301, and an elective course which is 3 hours. Refer to the Lone Star College course catalog for this course. You must have at least a grade of C or higher on all academic courses completed. Articulation, transition track, admissions criteria. Prior to application, the following courses must be completed with a GPA of 2.7 or higher and at least a C in every course. The courses are Biology 2401, which is Human Anatomy and Physiology 1, English 1301, which is Composition and Rhetoric 1, and RNSG 1301, which is Pharmacology. Courses must be completed and graded not in progress at the time of application. Other required courses for the transition track are Biology 2402, Biology 2420, Psych 2301, and an elective course, which has to be a 3-hour course. Refer to the Lone Star College course catalog for this class. You must have at least a grade of C or higher on all academic courses completed. Biology Pharmacology refresher information. Required biology and pharmacology courses completed more than 5 years prior to application to the nursing program must be refreshed. Options to refresh Biology 2401 course include Biology 2404 as the Biology 2401 and 2402 refresher. This course refreshes both Anatomy 1 and 2 at the same time. Or repeat individual credit courses for a new grade. Option to refresh pharmacology is just to retake the pharmacology course. HESI Admissions Assessment Exam. This is a nursing pre-entrance exam that applicants are required to take. 6 sections are required that the applicant complete from that exam. The sections are reading, grammar, vocabulary / general knowledge, math, anatomy and physiology, and critical thinking. The exam is offered throughout the year at LSC campuses. You can only take the exam at one LSC campus once every 60 days. And if you retake the exam, the most recent set of scores will be used for admission purposes. Study guides are available on reserve in LSC North Harris Library or for purchase throughout the LSC bookstores, online, or other vendors or retailers. You can find more information at www.limestar.edu/HESI-test.htm. Basic track ranking criteria for admissions. How we calculate the ranking criteria for admissions is that you have 2 sections, both worth 4 points, for a total of 8 points. Now, in the first section, you will take the GPA of the Anatomy 1 or 2 and the English 1301. So you would take the average of the GPA in these 2 courses, and that's how many points you would get in the first section. The second section is the HESI entrance exam. Now, for the HESI entrance exam, you have to complete 6 sections. The first 5 sections, which are reading, grammar, vocabulary, math, and A&P, you have to score an 80 or higher. And in the critical thinking section, you have to score a 750 or higher. Now you'll take the average of the first 5 sections, and then you divide it by 25, and that's how many points you're going to get in the second section. You will add up both sections for a total score.
Basic track nursing courses. Here you have an outline of the courses you will be taking once you're admitted into the nursing program. Our nursing program only starts once a year in the fall, so you can see that you'll be attending fall, spring, and then summer is an option. So it's an option to take a break or to go ahead and do the vocational nursing. And then after that summer, you will then attend fall and spring.
Articulation transition ranking criteria for admission. Now, the admission for this track, you will have 2 sections worth 4 points each for a total possible score of 8. In the first section, you're going to average the GPA of Anatomy 1 or 2, whichever is higher, English 1301, and Pharmacology, which is RNSG 1301. After you figure the average of the GPA in these 3 courses, then that GPA would be the points you will receive in the first section. Second section is a HESI entrance exam. From this exam, you'll have to complete 6 sections. Now, the first 5 sections, which are reading, grammar, vocabulary / general knowledge, math, and A&P, you have to score an 80 or higher in each section. The last section, which is the critical thinking section, you have to score a 750 or higher.
Now, after receiving these scores or higher, you're going to average the score of the first 5 sections, and then you'll divide that by 25, and then that's how many points you're going to get in that section. You'll then add up both sections for a total score.
Articulation/transition track nursing courses. Here you will find an outline of the courses that you will be attending after you have been admitted to the transition track. You can see that the program starts in the summer, which is June, and then you will also attend fall and spring for a 3-semester clinical program. Hepatitis B titer. At time of application, the student must submit proof of the hepatitis B titer. In order to be in compliance with the clinical site requirements, applicants must provide documentation of a quantitative hepatitis B surface antibody immunity titer completed within the past 3 years that reflects immunity to the hepatitis B virus. This lab result must be submitted at the time of application. The hepatitis B titer is a blood test that validates an individual is immune to the virus. Lab reports simply stating negative or positive are not accepted. If hepatitis B surface antibody immunity titer demonstrates a lack of immunity to hepatitis B, students must provide all the following with your application. They must provide documentation of the previously completed series of 3 immunizations, the original lab report of the titer, and evidence of at least the first booster shot in the next series of 3 to 4 immunizations after the negative titer.
Application submission. The application deadline for the basic track is in April, and the application deadline for the transition track is in March. The LSC system office processes all applications, and North Harris accepts 100 students each year for the basic track and 30 students each year for its transition track.
Things to expect after you have been accepted for admission or as an alternate into the program. After acceptance into the nursing program, there will be a mandatory orientation. For basic track, it will be in May, and transition track will be in April. Background check. Once accepted into the nursing program, all students are required to have a satisfactory criminal background check through the Texas Board of Nursing prior to formal acceptance in the nursing program. The background check cannot be done before being conditionally accepted. Any student who has a felony or misdemeanor conviction must have approval through the Board of Nurse Examiner's declaratory order process. This is done once the student is conditionally accepted. Eligibility for clinical and licensure. Nursing applicants must answer these questions in order to be eligible for clinical practice in conjunction with education programs and for the eventual licensure in the state of Texas. There are 3 distinct types of questions. They are criminal offense questions, chemical dependency questions, and mental illness questions. Completion of the associate degree nursing programs does not automatically qualify graduates for licensure examination by the Texas Board of Nursing. Please see the Texas Board of Nursing website. House Bill 1508. Consequences of criminal conviction. Notice of potential ineligibility for license. If you are applying for admission to a college program or enrolling in a college program that may prepare you for an initial occupational license issued by a licensing authority, and or if you later decide to change to a program that prepares you for an occupational license, please be advised of the following. 1. An individual who has been convicted of an offense may be ineligible for issuance of an occupational license upon completion of the educational program. 2. Licensing authorities that issue an occupational license to an individual who completes the educational program issue guidelines stating the reasons a particular crime is considered to relate to a particular occupational license and any other criterion that affects the decisions of the licensing authority. A state licensing authority that issues guidelines follows those guidelines with the Secretary of State for publication in Texas Register. 3. Local or county licensing authorities that issue an occupational license to an individual who completes the educational program issue guidelines related to criminal history and post the guidelines at the courthouse of the county in which the licensing authority is located, or publish them in a newspaper having countrywide circulation in that county. Applicants should contact their respective local or county licensing authority for more details. 4. An individual may request a criminal history evaluation letter regarding the personal eligibility for a license issued by a licensing authority as required by Texas Occupation Code 53.102. All applicants to and enrollees are encouraged to review all applicable eligibility requirements related to the respective occupational license. Questions related to eligibility requirements should be directed to the applicable licensing authority. Social Security number or visa. Although not a requirement for admission into the nursing program, our clinical sites require students to have a valid Social Security number or a valid international student visa as a condition of being assigned to that site. Students who are unable to complete the LSC Health Program Clinical Skills requirement will not be able to complete the program due to a lack of clinical placement.
There is a no smoking policy before or during clinical hours. It also includes breaks or while on hospital property.
Estimated cost of nursing. For current fees, please visit the following website: lonestar.edu/nursing-program-cost.htm. Fees are subject to change. LSC Campus Resources. You have resources such as admissions, advising, registration, learning centers, tutoring, placement testing, counseling, career exploration on the LSC campuses. For more information, please go to lonestar.edu/student-services.htm. Furthering your education. The associate's degree is the first degree in becoming a professional nurse, and many employers, as well as the Robert Wood Johnson Foundation, encourages the advancement of nursing to seek higher levels of education. This may be required to obtain a position, especially if the hospital is seeking magnet recognition. LSCS has many affiliation agreements, which allows for easy transition into a BSN program. This slide holds additional course requirements for most BSN programs. Please look over the requirements. This is a guide only. The student is responsible for verifying program requirements at his or her prospective university. Some universities may also require completion of a literature and/or computer literacy course. University nursing degree program websites. Here are some websites for a four-year institution that have the ADN to BSN program for you to consider. This is the end of the presentation. My name again is Juanita Garcia, Academic Advisor for the Lone Star College North Harris Nursing Program. If you have further questions, please feel free to reach out to me on the information on the slide. Good luck to you.